Now, this is how fires start. Irresponsible cigarette disposal. Be better, people. Be better. Not only is cigarette smoking a danger to our environment, it's also a danger to the smoker and people inhaling all that secondhand smoke. So let's look at one way we can overcome nicotine addiction from smoking. Varenicline. Let's extinguish this fire and nicotine addiction all in one. It has been estimated that 14% of U.S. adults are current cigarette smokers, totaling 34.1 million people. You tell 'em, Smokey. Cigarette smoking remains the #1 cause of preventable disease and death in the United States, killing more than 480,000 Americans each year. In fact, the probability that a lifelong smoker will die prematurely from a complication of smoking is around 50%. As with all drug addictions, tobacco addiction involves the interplay of numerous different factors: pharmacology, learned or conditioned factors, genetics, and social and environmental factors like marketing and product design. Look at these interconnecting paths. Let our map symbolize the interconnectedness of these various factors that contribute to tobacco addiction. Nicotine is an agonist on nicotinic cholinergic receptors in the brain, which are normally stimulated by acetylcholine. Nicotine binds to the two subunits of the receptor, causing the ligand-gated ion channel to open. This allows the entry of sodium and calcium, activating voltage-dependent calcium channels, allowing more calcium to enter. See those salty sodium peanuts and calcium milk? Our recurring sketchy symbols for sodium and calcium? This influx of ions stimulates the release of neurotransmitters, particularly dopamine, symbolized by that rope our happy, stimulated hiker is carrying. This results in rewarding psychoactive effects, like improvement of mood and enhancement of mental and physical functions. No wonder that hiker is looking mighty happy. Nicotine tolerance develops after repeated exposure. This tolerance reduces its primary reinforcing effects, resulting in physical dependence and withdrawal symptoms if nicotine is not present. That bridge is looking mighty unstable. We can liken those fraying reinforcing ropes to the decreased reinforcing effects from repeated exposure to nicotine, meaning dependence develops, like our hiker's dependence on that walking stick. This dependence means greater amounts of nicotine are required to experience the rewarding effects, like increased mood. Nicotine levels are affected by the rate of nicotine metabolism, which occurs primarily in the liver by CYP2A6, a CYP450 enzyme. That's why we've sketched in an abandoned car with a P450 license plate, our recurring symbol for CYP450 enzymes. One of the main targets for smoking cessation is therefore nicotine and the withdrawal symptoms associated with its absence. Nicotine replacement therapy, or NRT, involves replacing nicotine from tobacco with safer sources, including chewing gum, lozenges, and patches, which are designed to be titrated down over time. Replacement firefighter Nico is here to sub in for our weary firefighters. Just like we use nicotine replacement therapy to deliver safer sources of nicotine to replace nicotine from tobacco. Whilst nicotine replacement therapy is successful for many, other pharmacological interventions are also available, particularly for those who have failed multiple attempts with nicotine replacement therapy. Here to help Nico is firefighter Varenica. Oh, and look at her climb! Varenica climbs symbolizes Varenicline. Varenicline is one such pharmacological intervention. Varenicline is a partial agonist at nicotinic receptors and is indicated for use as an aid to smoking cessation treatment. Being a partial agonist, Varenicline stimulates nicotinic receptors, but with less intensity or effect than full agonists, which elicit the full response from the receptor. It also prevents nicotine from binding to these receptors. Douse those flames, Varenica! Like our pressure adjuster here allowing us to titrate our water pressure up, Varenicline also requires a gradual dose titration, increasing dosing over the first week of therapy. Patients begin on 0.5 milligrams once daily for the first 3 days, followed by 0.5 milligrams twice daily for the next 4 days, then moving up to 1 milligram twice daily for a total of 12 weeks of therapy. Your brain helmet, Varenica! A falling brain hat or helmet is our symbol for neuropsychiatric side effects. There have been reports of serious or clinically significant neuropsychiatric adverse events associated with varenicline, including mood changes like depression and mania, psychosis and hallucinations, as well as suicidal ideation, suicide attempts, and completed suicide. It is important to monitor patients attempting to quit smoking with varenicline for these symptoms, and to discontinue varenicline and immediately contact a healthcare provider if they experience these side effects. Someone needs to stabilize that shaking ladder for Veronica. Varenicline has also been associated with new or worsening seizures, hence the shaking ladder, and for this reason should be used cautiously where there is a history of seizures or other factors that may lower the patient's seizure threshold. Varenicline may increase the effects of alcohol, so it's important to advise patients beginning therapy to reduce the amount of alcohol they consume until they have a better understanding of how varenicline affects them. It's important our firefighters remain alcohol-free whilst extinguishing these flames, with a warning in plain sight on their truck. Let it remind us of the need to be wary of the potential interaction between alcohol and varenicline. Patients with underlying cardiovascular disease may be at increased risk of cardiovascular events. It's important to balance these concerns with the health benefits of smoking cessation. Verenica's heart-shaped patch is our symbol for cardiovascular events. But as she balances on that ladder, let it remind you that we must balance these concerns with the benefits of smoking cessation, as smoking comes with substantial cardiovascular risks as well, amongst other health issues. Advise patients to notify their healthcare professional if they notice any new or worsening cardiovascular symptoms, and if they experience signs and symptoms of myocardial infarction or stroke, to seek immediate medical attention. Concurrent use with high-dose nicotine replacement therapy, or NRT, has been associated with treatment discontinuation due to intolerable side effects. Let this pretty serious-looking "no road through" sign keep this interaction front of mind, especially considering many people seeking or who are candidates for varenicline may be using high-dose NRT. Whilst not limited to therapy with varenicline, always be mindful of physiological changes that result from smoking cessation, like changes in the expression of metabolizing enzymes, especially those in the CYP450 family. Hence our fire-damaged P450 license plate on our truck. Smoking cessation may alter the pharmacokinetics or pharmacodynamics of certain drugs with narrow therapeutic indexes, or those associated with significant toxicity risks, like theophylline, warfarin, and insulin, which may necessitate dosage adjustment. Varenicline is primarily eliminated by renal glomerular filtration and active tubular secretion. Dose reduction is not required for patients with mild to moderate renal impairment. It is, however, required for patients with severe renal impairment and for those with end-stage renal disease undergoing hemodialysis. When you see a shriveled kidney, think renal impairment. This shriveled kidney water tank on low reminds us to lower dosages of varenicline in severe renal impairment. Oh, lunch is on its way up! Common adverse effects of varenicline include nausea and vomiting, as well as constipation and flatulence. Ooh, that is one blocked up, gassy truck. Hang on! Hold up! It was one of those, and it was all just a dream scenarios. Well, our dreaming bear is having some very vivid dreams. Patients using varenicline may also report vivid, unusual, or strange dreams while using varenicline. But hopefully not fires like our furry friend here. Well, that's it for varenicline. Let's leave him to sleep. He looks cute while sleeping, but awake? I don't really want to be here to find out. Backing away quietly. Uh-oh.